Hi everyone, it's Dr. Dave Morris with Magnolia Medical Center. Hope you all had a great day. It was a great day here at the clinic. I am coming on to tell you that you might be seeing a lot more of me. I realized I went to a conference this past weekend, and the conference was about being obsessed. You're just 10xing your goals, really going for what you want in your life. And coming away from that conference, I realized that I really have a disease. That's what I realized. I've got a disease. I didn't think I was obsessed about anything in my life, but then I realized after looking at stuff very closely that my disease is I am obsessed about the idea of changing healthcare. I'm relentless about this idea. And the problem that I've had is I've been scared to death to get on this dang video and just communicate my thoughts and what I think to the public. And I don't know why that is. People get scared about different things, but I've been scared about communicating my ideas about health, and I can't be scared about that because things need to change. Things cannot stay the same. And healthcare change very much, and it needs to change. Now, I want to give you my ideas on a couple things here. I want to tell you, share this with you, is not every bit of healthcare is broken. If you got shot, if you got a broken leg, if you had a heart attack or a stroke, if you had a MRSA infection, God forbid, anything acute or serious like that, by God, we've got the best healthcare in the world. The statistics are incredible. There's not even a close second anymore. We have the best acute care in the world. The problem is we have some of the worst sick care in the world, which means if you have a chronic health problem, the statistics in this country about managing and handling that chronic health problem are horrible. There's a lady by the name of Dr. Barbara Starfield, and she did a study. She was the director of healthcare policy at Johns Hopkins University. And she did a study and showed that the, 225, this is in 2000 the study was published, but 225,000 people died that year from errors, from medical care, basically, from medical care in hospitals. Now, my uncle is a surgeon, so it's not that everybody there is trying to do bad work. It's that there's so many people going to hospitals for things that are totally preventable if they would just change how they view their health. Sick care is, just going backwards here a little bit, sick care is how we treat healthcare in this country. It's just not even by definition true. The definition of health in Dorland's Medical Dictionary, this is the same definition that the World Health Organization uses. Definition of health is a state of optimum physical, mental, social well-being, and not merely the absence of disease or sickness or infirmity. So what that means is health is optimum function. It's total optimum function. It is not an absence of a symptom. So just because you don't have a symptom doesn't mean you're healthy at all. You could have a heart disease and not know it. We've probably all know somebody who's died of a heart attack and they didn't even know that they had a heart problem. We all know somebody who's died of cancer. I'll do another video another time about cancer rates. But we know somebody who's had cancer, and it's 1 out of 3 now. 1 out of 3 people have cancer, and they could have tumors all over their body and have no idea that they have cancer. So not having symptoms has nothing to do with whether you're healthy or not. You've got to actually be well, and that's measured in function. So when we're just treating illness all the time, that's not treating health, that's treating sickness. So the definition of health care is the restoration and maintenance of health. And if we plug in the restoration and maintenance of optimum function, then it's plain to see that when you go see your doctor, they're not really trying to improve function. They're just simply trying to manage disease and symptoms, trying to manage those. So that is sick care. Now, what I want to do is I want to change that. And I found out that I was obsessed about this because I realized after listening to some entrepreneurs and some business owners and some really great public speakers and guys that are really trying to change their industries and give back and even change the world in many ways, I go to bed thinking about things that I want to communicate to people about health. I wake up in the morning with ideas about how can I communicate better about health. Literally hundreds of times a day, I think about how I can improve the well-being of our community and change health for the world. Trying to get ideas out there that actually have been proven in science. The research is out there. And if we could just get it broadly known, people could become healthier, spend less money on healthcare, or what we call healthcare. They could spend less money on it. They could live happier and healthier lives, and the world would be a better place. And I realized that I could change the world. Why can't we change the world? We might be able to do it just one person at a time right now, but if I can get this broadly out there and make it my mission to really change how people view healthcare, then man, that would be so great. You know, the United States makes up about 5% of the world's population, and this might be surprising to many of you, but we consume 55%, give or take a few percent, of the medication produced on this planet. 5% of the world's population consumes over half of all the medication produced on this planet. Factually, the United States, 5% of the world's population, consumes over 90% of the world's pain medication. So, and when I go out and I public speak, I do some public speaking in businesses and things around here. I ask people all the time, do you think we live in a healthy country? And nobody, even medical doctors, even nurse practitioners, nobody ever says yes. They all say, no, we don't think we live in a healthy country, yet we outspend the rest of the world on healthcare every year, and we take almost all the medication, and it's not working. So it's not my ideas that the system's not working. It is factual. It's in the research. It's in the numbers, and I'm dedicated to changing it. So I'm just kind of announcing to you that I've become obsessed about changing this and getting this information out there to everybody. Hopefully you'll want to stay tuned. Please share this. I want to get the message out there that things can be different. So to all the Facebook people out there, I hope you enjoyed this video. Please share it, like it, post it on Twitter, share it, wherever all this internet stuff goes out there. Stick it up there for me, and let's help change things for the better. Good night, everyone.